sometimes we don't seek out literature, it finds us. And that piece that really speaks to us, it gets at our core. And that had happened to me back in graduate school. I was literally thrown into the classroom I had been a TA for a semester, and then I was thrown into a classroom to teach a freshman comp class, and given the book I would be using. And the very first essay in this book was Joan Didion's In Bed. I sat down to read it before class, and I was sobbing by the end of the piece, because it was the first time I had read anything about migraine, any literature about migraine. And also it was the first time I felt so much less alone. Like, this person really gets it. This person, could be me.
Welcome back, everybody. Episode 28. Nick, who was our guest today? Our guest was Kathleen O'Shea. She is a professor at Monroe Community College, and she teaches English and literature. And Brendan, do you want to talk a little bit about something she did recently and what we discussed?
Sure do. We talk about her new book, Much More Than a Headache, where she discusses understanding migraine through literature. And it's a collection of stories and research of migraine headache and how people can come to understand what it really means to suffer from migraine. I think this is going to be a good one. I think if you think that you know what a migraine is, or maybe you've been a little cavalier in your usage of the word migraine, I think this will be some good level setting for people to understand maybe if what they suffer from is just a momentary headache versus a migraine, and what potentially people can do to be supportive and empathetic to those who have migraines.
Yes. Yeah. So we discuss what a migraine potentially is, how it impacts people, how people stigmatize it, and then we also move into her career as a professor in English and literature, and just the passion that she has for books, novels, poetry, all different types of literature. So we really hope you enjoy this episode. Thank you for tuning in. Sit back, relax, and enjoy the show. Thank you so much, Kathy, for joining us today. We are excited to have you here and talk about a topic that does not get a lot of discussion around. So just to start, we were hoping that you could share a little bit about how you got into literature, became a professor, and if you wanted to start to tell some of your story as well, that would be greatly appreciated.
Okay, thank you. First of all, thank you both for having me, and it's been a pleasure talking with you, and I look forward to the next hour or so. I first got interested in literature, believe it or not, when I was in high school, and I was in an honors class where we had a teacher who taught a variety of courses with a group of us, and it was not only literature and composition, but we had a course in humanities, general humanities, and also he taught us a course in philosophy. And so my love of literature developed, and the arts actually developed through that period. And I knew that was going to be the direction my life was going to take from that point on. And then in my undergraduate work and graduate work, we were both in literature, and was specifically focused in the 19th century British literature, primarily, with also a growing love of 20th century British literature too. And then I was fortunate. Immediately out of graduate school, my mother happened to see an opening back in Rochester, New York. I was in Binghamton, New York at the time, and just said, well, why not apply? So I was fortunate in the sense of they were actually looking for some new blood in the department. So they wanted somebody kind of fresh and new and inexperienced, and even and that I was. So I've been now at that college. It's a community college in upstate New York, in Western New York, and Monroe Community College. And I've been there for 34 years. So something made me want to stay. And that was not only we had back then, it's not quite so true now, but back in my first, say, 15 years, we had such flexibility in terms of what we taught, how we taught. We could design our own classes. And so it really allowed us to bring our passions for literature and areas of specialty and interest into the classroom. And, the school primarily focuses a lot on teaching and learning. You're not so much a research institute, although many people do write and publish. So anyway, it's the diversity of the student body is fantastic. And we have people from, over 40 different countries that attend the college. And so anyway, that's been my love of literature, which has obviously been ongoing. I married also a literature professor. So there's a lot of passion for that area in our household, needless to say. That love of literature merged with my migraine to kind of move to the migraine at a time when, I was in an intractable migraine for 3 months. Nothing was touching it. And the biggest problem was I was also psychologically in a very bad place because my very dedicated, caring, up-to-date headache specialist, whom I had been seeing for, I believe, 16, 17 years, had just retired. And I was feeling very helpless at that point. And I had nowhere to turn. That's a subject we can talk about maybe if you'd like to at some point, but the fact that there's so few headache specialists in the United States is a real problem. And it speaks, I think, to part of the stigma of migraine even today. And I finally realized that I remember exactly where I was. It was in the college. I was in my department chair's office when I thought, what, you're crazy. What do you always turn to when you're in kind of despair and crisis and grief and helplessness? And it's literature. That's what I turned to, right? So I went back to my office and I actually picked up an essay that by a very famous writer, Joan Didion, that I actually had found me. And I think that's something that I really want to touch on too regarding the book. And that is that sometimes we don't seek out literature, it finds us. And that piece that really speaks to us, it gets at our core. And that had happened to me back in graduate school. I was literally thrown into the classroom I had been a TA for a semester, and then I was thrown into a classroom to teach a freshman comp class, and given the book I would be using. And the very first essay in this book was Joan Didion's In Bed. I sat down to read it before class, and I was sobbing by the end of the piece because it was the first time I had read anything about migraine, any literature about migraine. And also it was the first time I felt so much less alone. Like, this person really gets it. This person, could be me. And so that made me want to research further and I thought, well, geez, there must be a lot of other authors who have been migraine sufferers, or they create characters or personas in their work that who suffer from migraine. And so out of my own interest, my own desire to help myself cope and get through a difficult time, I started just researching these works. And I had no intention of writing anything from it, not an article, certainly not a book. And then I just started digging, and the more I was digging, the more passionate I became, and the more I wanted to really pursue something with it. So that's kind of how it started.
Got it. I have to ask, just because I've got this growing like curiosity with like old school literature. So when you but I'm a novice without a doubt. So when you say 19th and 20th century British like classics or British literature, can you give me some ideas of what we're talking about? Because
Sure.
maybe I'll put them on my list.
Sure, absolutely. No, so my interest, my real passion had been, and what I really specialized in, because of my I love all of the arts from the British 19th century, particularly in terms of literature. My passion are the poets of that period. So like Wordsworth, John Keats is probably my all-time favorite. Coleridge, Byron, so those poets. But then, of course, the great novelists of that time too. Jane Austen would be one example. Also, the Bronte sisters, Charlotte Bronte, and I'm drawing a blank now. Wuthering Heights. It's her sister. I keep drawing a total blank, which happens with migraine sufferers, by the way, a lot of word drop. So, those would be some examples out of many. And then also the Victorian era, like with Robert Browning. You can't beat a Robert Browning dramatic monologue. So, particularly if you love art, he writes a lot about art and literature, and they're filled with humor as well as great kind of hypocrisy of the period and so forth. So,
okay, cool. Thank you.
Yeah. So before we even get any further, I'm curious about just like what your experience is of a migraine and what a migraine is. Brennan, yeah, maybe can't personally speak to it. So.
Yeah, maybe starting with, in your words, defining a migraine, and then getting into a little bit about, or like, yeah, for the person, or trying to articulate it to somebody who's never experienced one, and then yeah, pick up from there.
Sure. Okay, so this is not a clinical definition by any means,
yes.
Right? So it's difficult to talk about a migraine because it's better to talk about migraine because migraine is really circuitous, which is another reason I love to draw the analogy with literature, because much of literature is too, and so is life. So in other words, a migraine often isn't, for many people, particularly chronic migraineurs, is not linear. So it doesn't have a clearly marked beginning, middle, and end always. Sometimes they do. And when they do, they work like this. There are the warning signs, okay? And that's called the predome phase. And some people before that will get what we know as auras. And auras are the visual disturbances and patterns and lights and all of that can, when it first happens to you, apparently, I've never had an aura, but those who get them find them both beautiful in some ways, because it's just these incredible patterns and shapes and colors that they see. And an aura can last, I believe it's like, it can be like a minute, it can be up to 10 minutes maybe. But if you've never had one, and you first have one, I've heard that they're very disalarming and they're very, upsetting, right? So as you would expect. But if only 20% of all people who suffer with migraine get auras, I think most people think that most people with migraine have auras, but that's not true. So but most of us do get warning signs. And as we've learned only in recent years, these warning signs can be very subtle and very nuanced. And again, it's not until you've read about, or maybe you've been in contact with someone else who's experienced that you would ever consider it to be a warning sign. So I'll give you an example, because it's highly unusual. Excessive yawning. That's one of my classics. So, it's not the same kind of yawning as being tired, because you don't necessarily feel tired. But you could be, I remember one time driving home from work in my car, and I had a long commute for a very long time. And I could literally, it was nonstop. And I have TMJ also, which is a common comorbidity with migraine too. So can you imagine the pain I was causing? Because I couldn't stop yawning. And I thought, what is this about? But I never made a connection with migraine. And then I did get a migraine the next day. So it turns out that is a very common warning sign for people. Other common warning signs are sensitivity to light and sound and smell. And those can be triggers even. So for instance, where I go to get physical therapy every week for my neck and migraine, there is a sign on the door. Nobody that goes there can wear any fragrances, because for some people that can trigger a migraine. But I do have sensitivity to sound. So if all of a sudden I cannot tolerate even a TV or radio that's on at a very moderate level, I'll just say like to my husband, you got to turn that off. It's like now, and it's immediate. Then I know that's a warning sign for me. So these are some of many that people experience. So that warning sign means that the headache part of migraine is coming. So the common belief is migraine equals bad headache, and it's such a misunderstanding, because the headache portion of migraine is just one aspect of it. It's a vicious, excruciating aspect of it, but it's one part of it. So the headache comes, for many people, they get nausea and vomiting along with it. And then you go through your regimen of acute drugs, medications to try to cope with it. But there's a beautiful essay in here called, I think it's from The Lightning in My Eyes, where she describes that, no, maybe it's from Didion's even, describes that the only time that what really ends the migraine is when the body and the brain releases and the body gives in. Then you experience what's called the postdrome phase. And the postdrome phase for many feels like a hangover, very much like a hangover. You have a heavy head, you feel overly fatigued, you're kind of headachy, you could be a little nauseous, you're confused, your focus isn't clear. And that can last, a couple of days even. So that's the linear migraine. But for somebody with chronic migraine, it's circular. It's like I can start with the early stages of migraine, which for me is often this neck pain right here. It's very localized, right deep in here, which is why I get the physical therapy. And then it travels into this, excruciating pain over my right eye. It's always the same. And but then what can happen is it can get a little better with the right medications. It can reduce it enough that I call functional days. These are my functional days where I can mask it. People don't know I'm suffering, and I can work, but I can't do much else. So I go to social engagements. I have to cancel out a lot on things and people. And these are some of the losses that migraine sufferers deal with that a lot of people don't realize, and the sacrifices. And then it can go right back into a full-blown attack, or maybe it'll get better. So it's a kind of a cycle. And so when I said I had that intractable one for 3 months, I would have a lot of low-grade days where I could get through them. So it wasn't like I was in bed for 3 months, but it was never that feeling of what I call release from the body, where I feel like myself, I feel normal. So I probably went on too long, but that's sort of what they're like for me.
I think as you were describing that and like how there's these warning signs and everything like that. So, and this will be a question kind of geared towards like, what have you seen, if any, research done in this area? But has migraine always been looked at as an acute incident or a chronic incident, or is it ever looked at from a standpoint of like, something happened and the migraine is the symptom. So I guess I'm trying to gain an understanding of like, you see where I'm getting at? Like, is something else happening that these warning signs that you're seeing are a part of, and then the migraine is the negative repercussion of that incident? And maybe it's something that's completely unknown at this point, because obviously a lot, like you said, the headache specialist count in the country is, surprisingly low. I'm curious if anybody's tried to see from that perspective. Has there been anything from the way you understand that's like, how, I guess, better question, how are we trying to evaluate what is causing migraine for people?
Mm-hmm. Gotcha. Well, we've come a long way in the last 5 years, maybe a little longer, more like 7 years, a long, long way. So lots more research is being done. Finally, some federal money is being put into migraine, with 39 million migraine sufferers in our country alone. It's time that, the federal government started paying attention to this. And we now recognize it as a disease. So it's a disease it's a brain disease. There's a hypersensitivity that occurs in the brain. And the new medications they've come out with are now geared specifically to migraine, and I'm getting around to your question. They specifically geared for migraine, whereas up until, say, 5 years ago, any medication, whether it was to try to prevent the attack, or when you got the warning sign to prevent it at that point, or whether it was an acute rescue medication, were all medications designed for some other problem, some other disease or illness that happened to help with some migraine patients. So you can imagine we've really come a long way in developing research and migraine. And what we know about it now, people used to think they were just enlarged blood vessels, and then that was the inflammation that was causing the pain. Come to your question, how much research is, we know a lot of things that we have triggers. Okay. So I think, what has been researched, or what are the triggers? And that's the other thing, that migraine is so hard to treat, because every individual's triggers and warning signs and all of that
so much nuance,
very different. Right. And so like my triggers are clearly if I have a change in sleep pattern. So if I suddenly decided I wanted to sleep until 11 in the morning, that would probably throw me into a migraine. You have to have people with migraine have to have very consistent sleep pattern. So that's one thing. The second, probably the most important trigger for me, is stress. And what's very interesting, and I love the fact that a lot of the literature speaks to this, because I used to think this was only me, because I'd wonder, like, let's say I have an extremely stressful event coming up, or I've gone through a very, stressful, like, let's say a death or something, or just even like I've had to teach in front of my, vice president or something. And that I can get through it without the migraine. I'll always get through it without the migraine. And I'll think, gosh, I got through that, and I didn't even get a migraine. And then boom, the next day you get it. So it's something about that's happening in the brain that it's in the hormones, and I'm not going to try to do the science, but they're in the chemicals in the brain. I think that's more like it, that you get through the experience. And it's only when things start to settle and that adrenaline comes down that you get the attack. So knowing when some people have triggers like chocolate, some have triggers like wine, or any alcohol. Certain foods are triggers for some people. So they vary a lot. So one has to know one's triggers too. But, the problem is, overwhelmingly, I think stress is a major trigger for people with migraine. And yes, we know all about, certainly the importance of relaxation techniques and things like yoga and mindfulness and all that. But, let's face it, as human beings, and usually pretty, we all are very busy people, it's sometimes hard to reduce that stress, right?
Yeah. No kidding.
Yeah. And also, just to come back to your question, because I may not have approached it right, but there can be migraines can be the result of, let's say, COVID. There's been clear research being done to show that now we know bad headaches accompany COVID, but we also know now, I should say that the experts are learning that people with COVID and who have migraine are experiencing many more migraines after having COVID. So, or, a brain injury, a car accident can lead to a person becoming a migraine sufferer. So I don't know if that partly answers your question.
No, it does. Yeah. And I think, just this won't be specifically about migraines, but you mentioned it. And I think something that the more and more we've had conversations with people, the more I have come to realize that, especially with like the stress and the meditation side of things, we had a conversation with a nutritionist, and the more I just can't get away from this idea that like inflammation in the body causes an unbelievable amount of problems. And it sounds like in a certain way, that's a lot of what's happening here. Is there some kind of inflammation response that's kind of occurring when these migraines are happening? And again, I'm not a scientist either, so I'm not going to talk, I don't know about the science, but man, inflammation is just like, it's like what's the phrase? It's the devil in the details, or it's like it's always there. And it always seems to be a contributing factor in so many issues that ail us as people these days. So
sure.
It's an interesting thought.
Yeah, because I know that for me, again, that, I have the cervical component. So I have that muscle inflammation, and it's a very deep muscle. It's something like 6 layers deep, the one that gets me. And that for me is an enormous contributing factor.
So in order for me to kind of really get a better grasp or try to really understand the severity and what a migraine and what migraine is like, I'm comparing it to how like people see people who are sad and relate that to somebody being depressed. And it's like a headache and then migraine.
That's an excellent analogy. Yeah.
Oh, nice.
Right.
It is kind of fitting, because I think where I'm trying to get a better understanding is of really what that experience is like when you're in when you have migraine, like what is that like? I know there's the physical pain and the physical sensations, but yeah, what does that do to your like energy and
when you're
all these different types of facets?
Sure. When you're in a full-blown attack, you're not moving except maybe to be sick. And I'm just saying there's the wonderful passage. Again, I think it's in Didion's piece where she says that, okay, so it's not a fatal disease, right? So you're not going to die. And she says sometimes that's not such a good thing. And what she says, it obviously very beautifully, but what she's really getting at is the idea that you want to die in the middle of a migraine. I mean, you really want out, because there's just the level of pain. And believe me, people with migraine have a very high tolerance for pain. You have to, because you live much of your life with at least some degree of it. So I consider myself someone with a very high tolerance for pain. But if I'm in a full-blown migraine, I can't be touched. I can't move. I just want to, I want to die. That's how bad it is. And it's such a feeling of loneliness and helplessness. And you feel like it's never going to end, because you feel like, what is going to take this away? Particularly if you take your strongest, like injections, and it's not touching it. And then, it can go, one of the biggest problems and for people with migraine too, is what's called this, it's got a term like I'm going to see if I can find it right in front of me, because I can never pronounce it up. And it's, he had it here. Sorry. It's like darn it. Oh, here it is. cephalgeophobia. Cephalgeophobia. And what that means is a fear of the next migraine. So it's an actual phobia. And so what happens is when a migraine finally lifts, okay, so let's say it's finally totally lifted, you have that hangover often, but you also have a brief experience of, many people do, I do, of euphoria. It's like everything is beautiful and you have this profound appreciation for every little thing, right? But the very next thought is, when's the next one? How much time do I have? How much can I do and get done, because I don't know when the next one's coming? And yet, what if I overdo, that could trigger the next one? So you have this constant ongoing fear. So even when you're not in the migraine, you're in the migraine. You're in this state of it, of wondering when the next one will be. And I think too that your comparison, your analogy with depression versus being sad is a good one, in the sense of, of the general stigma and misunderstanding of the disease.
Yeah, and I think you touched on such a key point there too. Like in thinking about panic attacks, one of the distinguishing criteria for someone to qualify for a panic disorder is when they start to experience that fear of another panic attack happening. And so this ongoing thing that's constantly on your mind, constantly impacting you, even when it's physically fully not, that anxiety around it it's so treacherous.
It is.
Yeah.
It is. So it's your living companion, 24/7. I mean, it really is. That's one of the chapters of my book is called, it's a lifelong full-time job. And it is. And, in many ways, I mean that both literally and figuratively.
I'm curious just about, like, when did you first start to experience a migraine or migraine in general?
Now, I had it's funny, I think everybody who goes through migraine probably can remember very vividly their first. I was 14 and I was with my brother. We were camping up in the Thousand Islands with my parents, and we were in a rec center watching, believe it or not, talk about going back and making me old. I don't know why, even as kids, we'd want to watch this, but we were watching a Charlie Chaplin film. And all of a sudden, now I had no warning signs that time. When mine hit, it just hit like, and it's interesting. Migraine, it's interesting that one factor was that I wanted to write a book through literature, through words, right, to try to express migraine. And yet, whenever we talk about migraine, and I do it too, we use metaphors, right? So you say it's like a hammer just went through your head. Well, we don't know what it feels like to have a hammer go through our head, but that's the way we imagine it to be, right? So, and it was so powerful and overwhelming, and it was so fast, and I got so sick right there that my brother had to run home and get my parents, and they had no idea what to do with me. And that's the other thing that I want to say, that when, I'm 58 years old, and I got my first migraine when I was 14, and they knew nothing about migraine. I mean, they meaning like neurologists, who were the doctors you eventually would see. And, my neurologist dismissed it. So I just remember this one meeting we had with my mom, and he said to me, I really think this is more psychological. And I think that, are there things that you'd like to talk to me about, that you'd like your mother to leave the room so that you and I can talk? And I just went, what? My brother's my best friend. I mean, if I'm not going to tell her, I might tell you. And we never went back to him. I mean, but there weren't other people to go to. So they treated it with these incredibly powerful drugs that were used really for psychological illness. They were highly, sedative. And they didn't know how to treat it because they didn't know what it was. So I'm just saying we have come, a long, long way. And again, the fact that we know now that these CGRPs are, and I don't claim to not understand the science of it, but that's what we're using medications to deal with that part of the brain is what's involved in migraine. And they now know that, they've pinpointed that, and that's brought us a long way. But back then, it was terrible treatment.
Had you seen other people around you go through something similar or have experiences with migraine before you had your first encounter?
Mm-mm. No, in fact, that's also unusual because, for many people, we know that migraine is highly a genetic disease too. So typically that'll be one of the first questions your neurologist or headache specialist will ask you is who in your family has experienced migraine. And I haven't had anyone. So, it's probably maybe one good reason I wasn't able to have children because I wouldn't want to pass that on to anyone. So, but I did not know anyone who had them. No. And even in my school, again, there was no other, I came from a very small rural school, but, growing up at that time, I was sort of like, nobody got it. Nobody got it.
Yeah. I'm curious too. I mean, I can imagine when, back in the era of, early psychology in the United States where, I think we can look back and all think like, we probably made some fair mistakes with how we were approaching psychological disorders and attempting to treat them. And then also, like you just stated, trying to blanket, maybe something that was being used in psychology for anything else that has to do with the brain that couldn't be understood.
Yes.
In that, I can imagine, and I'm curious if you'd stumbled across anything. Are there any anecdotal stories of people like going down the home remedy path in the past and finding success that have, because of the limited amount of research that was done? I mean, I can imagine people are kind of forced into that, like, I need to find something that's going to help with this and going through other solutions. So, is there anything you came across that was particularly interesting in that regard?
Yeah, I think that some of the pieces I have in the book that are from 17, I have actually one from this medieval times, actually. But it's a brief poem that tries to, and I think really well, it does it very well, express what a migraine feels like. So it doesn't go into the area that you're speaking of, but there are a couple poems by a woman in the 17th century, and Jane Cave Winscombe is her name, and she writes about trying anything and everything, in her poems, and nothing really working, but doctors trying very, rudimentary treatments to try, the kinds of things you can think of that were home remedies that doctors would use, they used. And also there's a piece, a lot of the 19th century literature, for instance, women were, and this part of the stigma that remains today, to be honest with you, is that it's a woman's disease. And is it true that the greater proportion of migraine sufferers are women? Yes, that is a fact. However, when I say doctors considered it, and psychologists all considered a woman's disease, it was kind of treated like, what's the word I'm looking for? The woman's, where they would treat her by being left alone and isolating her from everybody and everything, so that, kind of the frenzy, the woman's frenzy, and that the treatment would be to, keep her from being creative, from doing anything that because she needs to be mellow, she needs to be calm, right? And if we can calm her, that's going to take care of the headaches, it's going to take care of her illness, because it's largely psychological, was the idea. And so it's been treated that way and looked at that way ever since, because of course, back in like the 19th century and so forth, also women were considered, right? So, like in the Victorian age, just sort of, kind of weak and frail. And so we had to treat them with great care. And so migraine has that stigma still. And that's why it's, just a headache. It's like, why can't you just take a couple aspirin and, brave your way through it? So that stigma we see throughout history, but, primarily in the 19th century, but it's carried on today.
You mentioned some of the poems that were in the book already, but one thing that I think, the way you formatted the book that's, I think, really impactful and powerful for people who may read it is I remember hearing somebody, a psychologist, talk about some of the older works that came out of the 20th century, like post World War II, and some of the ways that they would describe some of the events that happened through narrative, and how doing that was more real than reality, because the information being passed along was universally true amongst all people. So that giving one story doesn't necessarily speak truth to somebody, but when you lay out a story that anybody and everybody can relate to, especially people in your case who are experiencing migraine, it's more powerful than a single story, because anybody can get it and really understand. Are there one or two stories that you included, or one or two passages that really struck you when putting this together, that you just like were like it hit you like a truck, and it was just like, man, that's it,
Yeah, I couldn't even name you one or two, but obviously Didion's I mentioned already. And what I've done with her work and with Anna Leahy's essay, Half Skull Days, which is another one that hit me like that. Mm-hmm. I framed the book with those two pieces because they touched on all five themes that, in a major way. And I think they speak to that universality that you were talking about. And, if anybody's going to first pick up a piece who suffers from migraine, I would start with, I'd probably start with those two. But I'm also a believer that, if somebody says, well, I'm not interested in this book because I don't really read literature. Yeah, then my response is, then you haven't found the right piece yet. You just haven't found the right piece. You need to find that piece. So that's why I think a lot of people may not want, read the book from beginning to end. Although I think the pieces in it, and this has no reflection on me, it's on the authors, are so powerful in and of themselves that you will find something in almost every piece that speaks to you. But I would say for me, probably those two, but there were so many others. There's a wonderful novel that probably, just to mention, people may not be aware of, called Claire's Head, that is about a woman that has migraine herself, but her sister has it even worse. And she's trying to locate her sister because she's very worried about her. But you experience her migraine suffering in her attempt to locate her sister. And then there's this wonderful passage at the end, and I only excerpt it, obviously, where it gives diary entries from the sister about her migraine. And it really, it's like it grips you. It's just absolutely gripping. Again, like, so, but there are poems in here. There's one by Gail Mazur called I Describe a Migraine, or Dear Migraine. That one is, I guess, Dear Migraine, where she's actually speaking to the migraine, which is terribly powerful. And then, there's an excerpt from Michael Cunningham's The Hours, which was based on Virginia Woolf's Mrs. Dalloway. That, again, it captures the essence of the full body experience that migraine is. rather than just the episode or just the headache. But I could go on and on about the pieces because obviously fell in love with everyone I decided to include.
Yeah. And I know you spoke to literature allowing you to not feel so isolated in this. And so I was hoping that if you could speak to a little bit of why you structured the book this way, the motivation behind that, and just for listeners or viewers to get a better understanding of what the book really is.
Yeah, thank you. I would like to. I initially thought as I said, I never thought about making it a book. And then I started thinking about, once I decided to even give it a small idea, I thought, well, I guess it makes sense to do it chronologically. So I'll begin with my medieval piece, right? And I'll move all the way up through. And then I thought that's not going to be of interest to the average person with migraine. That's not going to, I got to think about my audience here. And my audience is going to be more interested in, I want works related to blank. I want works related to this, or this is what I'm experiencing now. I'm going to, and maybe it's not what I'm experiencing some other point. So what I thought about is, what do some of these works have in common? What are they coping with? What are they dealing with? And I will say that I have 5 themes, and they're themes that I think are kind of central to anybody who suffers from migraine. So obviously the first is the migraine itself, the experience itself. And then what I do is I break it down into works that are on the aura and the warning signs, and then works that are on the headache itself and the experience of the headache itself. And then the postdrome phase, where that euphoria or hangover experience is there, and also that fear. And then the second chapter, focuses on the invisibility of migraine, and all of the works in that chapter. There are a variety of poems and essays and excerpts of fiction, and like sometimes whole stories, and that's probably the longest chapter on the migraine. The longest chapter would be the migraine itself, and then the invisibility of migraine, because there's so many. It's an invisible disease, and that causes and impacts us in so many different ways because it's invisible. And the third chapter is called "It's Just a Headache?" So those works, focus on the frustration, the loneliness, the isolation we feel that when people, either want to offer you, oh, have you tried this? Did you try this? Did you try this? And of course, most of us have, maybe not most of us, but if you're as old as I am and you've had them as long as I have, you've really tried about anything and everything there is. And so it's hurtful, it's disappointing. It's feeling misunderstood. So there's that chapter. Then the next one is it's a lifelong, a full-time job. And that one I have works that speak to not only the many, many coping mechanisms and treatments that we go through, and how working our lives and our schedules around Botox, nerve blocks, injections, neurological visits, PT visits, chiropractor visits. I mean, it's like your life is filled with everything around migraine, not even just the migraine itself, so it's trying to do everything you can to cope with it. And it does feel like a full-time job sometimes. And also the idea that you have to realize that there's a wonderful work in there that speaks in that chapter to the fact that, migraine has become my companion now. It's like that resignation that, no, there is no cure. There are these great new hopeful drugs that keep coming along, and they've helped a lot of people. There's no question. We're in a much better place, as I've mentioned, but there's no cure, and there will be another, and it's kind of coming to that realization for many of us. And then finally, the last chapter is When It's Gone. And then that really deals with works that focus on the areas that I talked about, specifically the euphoria, and the hangover feeling and the fear, of the next. And then I ended again with Anna Leahy's Half Skull Days, which I think encapsulates, and she references to Didion's work, and she references a couple of works that I also have in the book by other great writers. But her own experience is just the way she's able to write about it. She's a great poet, by the way, too. And has been very supportive of me in this book. So I'm very grateful to her for that.
Yeah, I think we can go on really like forever about the invisibility of this, because I'm guilty of it myself. That I don't experience migraine personally, but there's people in my family who do. And there have been several times to where they'll say that I have a migraine. And what comes into my head is, okay, you have a temporary headache that you just kind of have to push through.
Right.
And I don't want to see you suffering. So I'm going to tell you oh, let's go, let's get up, let's go do stuff.
Right. Exactly.
And then
right.
It just feels, so invalidating, because it's so hard to fully understand. And I felt like I did not take the time to understand as well. I
think that's I think that's a good point. I mean, I think that's what's really important, is what people with migraine want are people to really just, to listen and to try to understand it, and because I've come up against, countless times where I'll, someone say you are you sometimes my eyes will droop. I mean, people who know me well know when I'm having one, because they know the difference in my face. And but I've had many people who will say something like, you don't look like you feel that well or something. And I'll say, well, I'm in the middle of a migraine, and they'll say, oh, I used to get those too, or I get those once in a while. But no, you don't. It's clearly you don't.
Yeah.
I
think that's a great point. I think there is even this minimizing of what it really means to have a migraine, because I think there's been this cultural adoption of the term to blanket over any type of headache.
Yeah.
And I think it in a way, because then to defend where maybe Nick was coming from on that, because I think a lot of people fall into the same trap, is I knew somebody, they told me they had a migraine. Maybe they didn't know what a migraine was. They were misdiagnosing themselves. And now they see them, 20 minutes go by, they're over it. And they're like, oh, cool. Now I know that's what a migraine is, when really that's not what a migraine is at all. And so I think culturally we've completely mislabeled. And I think we do this with a lot of stuff, right? A lot of people, unfortunately, will take advantage of the situations that are hot in the press or whatever, and do whatever. And they will then try and be like, oh, well, I'm part of that special group too. But it takes away from the people who really experience what is going on there. And I think, I think that's a big problem. Because I'm in the same boat as Nick. I definitely, see somebody who says they have a migraine. I got no clue what that means. I think they're just talking about a headache. But there's really a disservice being done culturally to people who are suffering from them, because we've just put this blanket term and we like to treat it like it's just a headache, but it's clearly not.
Right. No, I think, I think it's great that you're saying that, because I think that's the norm. I mean, that still is the norm. And that's why it was very interesting when I first put in a proposal to my publisher for the book. One of the editorial comments was that, if they were to consider this for publication, I needed to broaden my audience. So, and they were right on, in the sense that what I was doing was very much limiting it to a targeted audience for people with migraine, and the people who already get it. And what I needed to do is broaden my audience so that it would also be targeted to people that don't have it, but maybe either know someone who has it, as a family member with it, or a friend or a coworker, or also, I ended up dedicating the book to my retired headache specialist. And when he reviewed the book, he said, I just so wish I had read this before, while I was still practicing. He said, I would have looked at every patient, and he was a very kind, caring physician. But he said, I would have looked at every patient differently and more individually, and really tried to hear their story. And that moved me in the sense that I thought, wow, that's what I want. That's what I want.
Mm-hmm. Yeah, it's Brennan and I were having a conversation last week, and I was telling Brennan how I'm pretty frustrated with the brain sometimes about how like we don't like what we don't know. And
right.
So like we see it, we think it's a headache, we see similar symptoms, we don't fully understand migraine, so we're just like, it's a headache.
Yeah.
We want to make it as simple as possible in our mind.
Right, exactly.
Yeah. But broadening this understanding is so helpful, because it's funny the way that you're describing your symptoms. The person that I'm thinking about in my life who suffers with migraine comes with those same triggers and like the similar symptoms of like a neck pain and then an eye pain. And I'm like, what is going on? And then we'll be in bed for like a day or two. I'm like, what? Like this is a migraine, but like, what is happening? Like, is it just you weren't taking care of yourself before? And so I think that's another even piece too of like,
yes,
what are you doing to manage your health if this is happening recurrently? And that's not the case.
Right. And, it's interesting because there are things that we need to do to manage our health, right? Like, exercise is important. And yet sometimes it's impossible, seemingly impossible to do that. And you go through periods where you just can't, but you do need, to take care of yourself and your health. General health, is just as important. So, good exercise is an important. I've learned, and I'll be honest, only in the last year have I really focused on that aspect of myself to try to help manage and cope.
For people who don't suffer with migraine, but do care for people around them with migraine or have very close loved ones, I know that you really touched on the listening and just really trying to understand what's going on, but do you have suggestions for how to approach those, like just like gentle care for others?
Yeah, for someone with migraine, like if you care about someone with migraine,
yeah,
I guess, I have a number of close friends who really have worked very hard to try to understand migraine, and listening is, I think, one of the most important things. And taking seriously, learning as much about it as you can. I mean, I think again, it's like my husband has been, he's been through this with me for 30 some years. And you have to respect what the person can and can't do. And also, I guess one major thing is if you're a loved one, don't put on expectations that really are impossible for your loved one, in the sense of, if I suddenly, if I make plans, that's another thing. People with migraine and a lot of different illnesses, I know, but with migraine, it's very true. You're very fearful about making plans for anything because you don't know, right? So, and people get, if you have to repeatedly cancel with someone, let's say that you're going to get together with, people get frustrated by that. That's very human. And they start to doubt you. They start to think either that you don't care about the relationship enough, or that, you're just one of these people that quickly just, cancels things. But try to have compassion for that person and know that we don't want to cancel on something that we've planned. That's not something we want. I actually experienced that problem with a family member for the first time in my life that was heart-wrenching for me. It hit like me at my core. I was supposed to go to a anniversary party for this person in my family. And I was going to take my mom because my dad wasn't well enough to go. And I had agreed to take my mom. And the night before, the migraine hit. And I knew I would not be able to drive that distance and be able to stand up and be around people. I knew it that night. And so I canceled early. And it was true. That next morning I was still in bed and it slept until like 2 in the afternoon. Didn't sleep. You don't sleep, but I was in bed till about 2 in the afternoon. And I got lucky. It broke. The medications worked. It was a lucky time. It broke. And I was able to attend something that evening that even though I was still had the hangover feeling, I was able to go, and I did. She happened to see it on Facebook. Now imagine her reaction. She sees on Facebook that I've gone to something later in the day, but couldn't make it to her event in the morning and canceled the night before. I get it. It looks bad, in a sense, right? Unless you know the person and you know that I would never cancel it if I felt I could possibly drive and it was safe to drive. And it just hurt me because I felt so misunderstood. I know I hurt her, but I didn't mean to hurt her. Does that make any sense?
Mm-hmm. Yeah. I'm just thinking too, like, in other scenarios where, things like this may come up, like obviously non-migraine scenarios, I feel like for me, having, open communication with people is like has been really important in my life.
Yeah.
And especially like, if there's a situation where I fear that something may have to get canceled last minute, or, if there's if I have if I get sick or something like that, just like expectation setting is like, has been really important for me of like, hey, when I get really sick like this, it can be, I had recurring ear infections when I was a kid. That was like kind of a problem. So like, it can be whatever, but
right.
if you can just have the agreed upon, like, hey, when this comes up, this is what I need from you. This is how you can be supportive. And from my perspective, like asking that question of how can I be supportive to you? I feel like that communication often gets overlooked in a lot of people's lives, like on how truly valuable it could be in just like navigating a hard time, like really, really solid,
Absolutely.
So it's kind of what I'm hearing from you is like been for you, just communicating with those people and having, those things
vital.
laid out. Yeah,
it's absolutely vital. Yeah.
Going through your journey of experiencing migraine for many, many years, what has been helpful for you in this process? I know literature is a big piece, but like,
sure, but not literal. I mean, yeah, in terms of what's been helpful to me, I have a wonderful support network. I mean, I think I wish that for, I see people, since the books come out, I've had a lot of communication with people, and people don't have that. And I feel desperate for those people, because without that, I don't know where I'd be, what I'd be. I've had loving parents that have tried everything they could back in, in the time. And also when I was, a young adult, and through the years, they're still they get it. They totally get it that, and also I have very supportive friends, but then and I'm very fortunate that way, but also having great, medical support is crucial. And a lot of people don't have that. Find someone to work with. Like I said, the headache specialists are so rare now that in my situation, I'm having to see a general neurologist. I'm very fortunate with her. She works well with me. She knows that I tend to stay up to date on a lot of the current research and medications coming out. She'll listen to me. But I also have these other managing pieces, as I mentioned, like a physical therapist I see every week. I have a chiropractor that will work specifically on the area, the areas for migraine. And I also have to say I'm fortunate because I have the means. I have good insurance. And believe me, the medications for migraine, you have to have a number of preventative ones, and you have ones that are just, maintenance drugs that you take. And then you have the rescue medications. They're extremely expensive. And they're very, the ironies too that are very frustrating are that, for instance, there's a fairly new abortive medication, rescue medication, and the insurance company, and it works pretty well. I mean, a lot of times it really will abort a migraine for me, and it's one of the new group of medications. But anyway, and the insurance company will cover 8 pills per month. Now, a chronic migrainer, by definition, is a migrainer who has 15 days or more of migraine per month. So right there, you see the problem. So what a lot of people have to really struggle with, and with this particular medication, I do too, but a lot of people have to struggle with this with all their medications, even if they can get them, is, when do I take it? So you're told to always take it at the first sign. Well, yeah, but what if I run out before the end of the month, which I'm likely to do, so you wonder, do I wait? So
cut them in half.
Yeah, exactly.
Yeah.
It's very frustrating. And insurance companies have, made it very difficult on the medical professionals too. So I guess what I would say is you need the medical support. You need to, good insurance. And I'm just been blessed. So in those respects, I cannot complain, but I desperately feel for those. And you see examples in my book too of people who are struggling with these things where they don't have those kinds of support systems in place. And I just ache for them.
Mm-hmm. Yeah. And the different types of layers and factors and systems that are all at play. Because then you just have to suffer through it. I mean, you have to suffer through it regardless, pretty much, but you just have to suffer through it. And then we have the label of this is probably just a headache. So taking off work might look bad on you. People get the wrong idea that you're just skipping out on work and you're weak, something like that.
There's a piece of fiction in my book that where a woman is leaving for the day, and I guess she's had to leave because she's got all the warning signs, and she knows she has to get home while she still can, and she knows that what her boss is going to think, and she knows that she's kind of on thin ice because she's missed so much work, and a lot of people on migraine end up on disability. And are not able to keep jobs. I think it's very difficult. I'm very fortunate in that respect, and have been at my workplace.
Mm-hmm. I'm curious too, as you've kind of navigated the healthcare system in this regard, is there like a well-established like standard of care when somebody comes in and is expressing having migraine symptoms, and like, is it any good? If there is, like how are we like starting people off? Because at the beginning of this conversation, we talked about how nuanced every individual is in like how it manifests and what their triggers can be. And I'm assuming how to resolve those things. I can imagine, because the healthcare system is, very steadfast in standard of care, that sounds like a blanket one size fits all thing for a problem that's not one size fits all at all.
Right. Yeah. So, that's it. So if someone goes to their physician and says, I'm getting these really terrible headaches, I'm having all these symptoms. And again, until a person this is the other thing. Until a person has been educated themselves about migraine, you don't know what to look for in yourself, right? So I might not realize that there's been this pattern of warning signs. I might not realize there's a pattern of triggers for me until somebody, I either, start looking into it myself, or a doctor starts to ask you those questions. But a general physician, they're not trained to do that. So, they're not specialists in that area. And, that's why getting into a neurologist is kind of the first big step in trying to get some good neurological care. And that's not easy. And to get into one that really will listen. And, and I'll tell you the truth. My neurologist has been very honest with me about this, that people are not they're not taking the next step to become headache specialists. They're going because they find other diseases they're working with much more. And this is a word that one of my neurologists used, that they find the other diseases that they treat much sexier to deal with.
So part of me knew that you were going to use that word.
Really? Interesting.
Yeah.
And
I've heard it in other forms of specialties of medicine where people are like, because the unfortunate reality is that I think there's too many people in the healthcare setting who do want to do it because of some of the notoriety that comes with being a healthcare professional in that way. So if that's your motivation and you're a smart, intelligent person, what's sexy? What is the, you want to be the guy who you probably also want to be the person who helps who helps cure like brain cancers, right?
Right.
If you're focusing on like the head stuff. So it's so unfortunate. So
yeah. So they for instance, one said that it's much more fascinating for us to work with, say, Parkinson's disease patients, because, there's so much research and science being done about that. And with migraine, migraine. Okay. So these are the treatments for migraine, and migraine patients take a lot of time. We're kind of high maintenance, if you want to help us really help us, and they don't have the time, and that's a reality. I'm not blaming them. It's a reality. But that's why, and also the other reason that I've been told by neurologists themselves that people aren't specializing in migraine and headache areas is it's because of the stigma still attached to it. That it's, this is a word I was searching for earlier, that whole idea of it being like a woman's hysteria, that whole way of treating hysteria back in the 19th century. And there's still that stigma attached, it's just, it's this woman's disease. And it's, it's not all that exciting to treat. And also it can be very frustrating for a headache professional because so many things don't work. There's so much trial and error in treating migraine. And then what works doesn't work for forever. It changes. So, and also they have to be very current with all the this is a good thing, but with all the research now and studies being done on migraine finally, and new medications and treatments coming out, then, they have to be able to really stay current with those. And a general neurologist doesn't have the time to do that. So it's very hard for people to find good care.
Yeah, I'm so interested in seeing where we'll be at in like 100 or 200 or 1,000 years, and looking back on like what we were doing for like even mental health in general, and then also just medicine in general.
How much are we getting wrong?
Yeah, how much are we getting wrong? Are we right about stuff? Are we making a lot of progress, or are we going the other way with some things? Which it sounds like there's been a lot of progress within migraine research, which I'm really happy about. But yeah, at the same time, it sounds like it's still so personalized, and the research isn't there yet, that it's so hard to really fully understand.
Right.
Yeah.
Yeah. I think in 10 years we'll be a lot further along. I really do.
Yeah.
I think they've come that far.
That's great.
So, yeah, like for my retired headache specialist still works with the Rochester Clinical Research Study Program, and so they do migraine studies that really contribute to a lot of the new treatments that are coming out. And so, it's a very active process still, which is nice to know. And they're also, like a lot of people are reluctant to take, a lot of medications for obvious reasons, right? Because you deal with all the side effects from them too, of which there are many. And so I know someone, for instance, who I get so frustrated with because pretty clearly, I can't diagnose her, but I believe her general practitioner has determined that, he thinks she has migraine. And it sounds to me like she has migraine. She won't take anything, even these brand new, medicines she won't take. So I advised her, I don't know if you're familiar with the cephalate device, for instance. There are a lot of different, non-medicinal treatments for migraine as well. But I've used a cephalate device as my daily practice for probably 15 years now. I mean, if I think that's, but almost since it first came out. And it's actually a magnet that's put on your head right here. It's a small device, and it works by following it's like an electrode kind of thing, right? So you press it, and it has an hour pattern built in where it follows the trigeminal nerve, which is very involved in pain related to migraine. So it can be used as a preventative measure, which is basically how I use it. Or if I'm getting early signs and I want to try to abort it. So I'm just saying there are other new devices like that are coming out that, so it's important to educate yourself as well. And I think that helps a lot. I think in dealing with a disease like this now, it's almost critical that you stay current with what's available, what's been approved, FDA approved, and that kind of thing.
Yeah. So just to transition a little bit, so I attended community college, and I had an English professor that I thoroughly enjoyed. That it kind of just really changed my whole view about like English classes and literature and writing. It was so
Wonderful.
great because he had us draft our essays like 10 times. And so we'd only have one essay due over the whole like semester or year. And it was a beautiful experience. And so I think I just want to know more about like your passion for literature, your passion for English, and what your experience has been like as a professor and going through all of this and teaching such a diverse population. Because that was something that was great too. Like the students that I interacted with came from so many different places. Yeah. Some were incredibly like educated and went through so much school. Some are still novice, but that's a beauty in itself too, because they bring to the work like such a new perspective. So yeah, I just wanted to ask about that as well.
Sure. No, I'm happy to talk about that. So whenever I tell somebody I've been working in one place for 34 years, they say, oh my God, how could you stay in one place for 34 years? But the very reasons that you just brought out. So my goal when I enter like an intro to lit class or something is like, I love teaching, I like our higher level courses a lot because obviously those are, students in there that are highly motivated because they're either English majors or they're obviously transferring and so on. But what I love about teaching like an intro to literature class is that I get all these people in there that may be taking it because it's a requirement, or they may be taking it, for a variety of reasons, but I get a chance. I have 15 weeks to spark them into developing a passion for literature and writing, and reading. And I love that chance. Even if I can hit somebody like you and I can have the effect that professor had on you, which, cheers to, I think you said it was a him. Cheers to him. I love it because that's the best reward that a professor can get is to have, a student come out of a class feeling like you have about that one. And that's what I still love. That's what keeps it fresh for me. And, so we also have the beauty of, like 100 fresh new faces getting to meet 100. Of course, it hasn't been so easy remotely. I'll be glad to go back to the classroom for sure. But, 100 new fresh faces every year every semester that we get to meet from, like you say, of many different countries, many different economic backgrounds, many different cultures, age groups, that you might have or sometimes even get, students that are still in high school that'll take a intro to lit class or a comp class. So you might get them from like 17 all the way to I had a couple take audit a British lit class of mine, and they were like 82. And it was so wonderful. I mean, they were so worried that they weren't going to fit in, right? And yet they brought so much to the group, and the group respected them. And it was just this beautiful experience. So I guess what keeps me passionate about teaching at the community college level is that it is so new and so different every semester. And even if you're having a bad semester or you've got a bad class, particularly bad class, it's going to end and you're going to have a whole fresh start with a fresh group of people. And like I said, and I never keep the same book twice. I rarely, I should say, not never, because I'm always looking I want to find that literature that's going to spark that student, like you were. And I too agree with the idea of drafting piece, numerous times. I mean, and one thing I'll say about in terms of teaching composition, which, we have a pretty heavy load of that now because that's a class required of all students who attend the college, is that I can use my experience as a writer, in writing this book to show them, look, I'm not making you suffer here. There's a reason for the process. And this is I'm doing this too. And this is, the revision process. I bring in my stacks and folders of the number of times I revise, say, the preface for this book. And the fact that, revision takes time, it takes commitment. But I think the thing I most want them to come out of a literature class or a comp class with is the ability to appreciate the power of language, the power of the word. So that, say, in writing class, I try to make them see that every word matters. Make every word matter. Don't get lazy with language because language has such power to it. And, we speak to the various ways in which it does. But that's what keeps me going, and why I love being there.
I think the revision process is just like such a good metaphor for life too. Like we're not just good at the first thing that we try. Like it's a process of learning and failure and growth. And it's so inherent to who we are.
Yes.
Yeah.
Right.
Yeah.
And so that when you're speaking with someone, I try to emphasize the difference between speaking and writing too, because if you're in a conversation with someone or even a debate, an argument, where we've got different positions on an issue, you can ask questions, right, to the other person. And you can say, no, wait a minute, but what about this? But when you're writing an argument, you got one shot, to really try to anticipate the audience's responses and how you can manage those and cover those and not leave holes in your argument and all of that. So it's like you need to recognize, right, the power of revision on so many levels. And so, I'll emphasize with them, the different steps of revision and not to do it all at once, that's why it takes so many different drafts, is that you want to deal with the revising it in so many different ways, like globally, and then, more in terms of style and editing and that kind of thing. So I find it exciting. Sometimes they do, sometimes they don't, but
yeah, you spoke to the power of language, and I'm starting to learn just more about, as I mature and like read different types of works, just like the beauty of like what people can put down on paper and how people can explain things and describe things.
Took me a long time to like absorb that like the art form that is like a really well written piece of literature. Yeah.
Yeah. And I'm curious if you are recommending for people to kind of like get into literature and really want to like pursue that a bit more or start to spark an interest in this. Do you have any recommendations? I know you mentioned earlier, sometimes we don't seek it out and it finds us, so it will pop up. But yeah, what would you say to that?
Oh, that's a good question. I would pick up if I were interested, I would pick up an anthology. I mean, I would start with an anthology and maybe related to some theme or topic that you're interested in. Because believe it or not, you can find anthologies, collections of literature, with stories, poetry, drama, fiction, related to almost any theme. So, for instance, there are sites like poets.org, is a great one or the Academy of American Poets, the Poetry Foundation, those kinds. And, there are certain poets and certain writers that, lend themselves to more accessibility, to beginning readers. Like, I call, beginning readers in the sense that they haven't yet developed a love of, like you're talking about, the love of just the beauty, aesthetic beauty of a particular sentence or something. Mm-hmm. So I try when I'm teaching like an introductory class, I want to find themes first that the students would be interested in or that are current in some way or universal, to come back to your idea of the universality of language. One thing I love to do is to take in an exercise at the beginning of a lit class. I do this, sometimes even use it in a humanities or comp class. I use two stories on a generally same theme. One that's actually an excerpt from a romance novel, and the other that is a piece of what I would call literature with a capital L. And they're related in terms of their theme, but one is kind of literature and the other is clearly not. And I asked them to read the two stories, to annotate them, and then I ask them a few questions to consider before they come to class. I want to know which one you liked better and why. And maybe you'd have the same answer to the second question, but maybe not. Which one do you consider better literature than the other, and why or why not? And then we debate them. And, and it's very interesting because, somebody might say, well, one, like the ones that's a romance novel, well, it's very real. I find that it was very realistic. Well, it was about a woman basically who couldn't have a child and found out she couldn't have a child. So she didn't think the guy she was going to marry was going to marry her. And the writing is horrible. And it's just, dripping with sentimentality. And, it's just, oh my gosh, just horrible. And, but they look at the subject and say the subject is real. That does happen. But of course the fiance handles it almost too well. It's like he doesn't have any reaction for himself at all, like disappointment, which he probably in reality would feel, right? But he's just all over just saying, I love you. He has this great line where he says, I love you, not your procreating ability. I mean, I just find it's the funniest sentence in the world. Like, that's not the way we talk. And anyway, so once I read that aloud in class, they see how bad it really is. But then the other one is just so nuanced and so subtle and yet so real at the same time. But it's a beautiful way to look at the power of language and really see, well, what is the difference between, something that's worth reading. And I emphasize, escape literature, that's fine if that's what you're reading it for. But if you want to read a great piece of literature that speaks to us universally, then perhaps this is the one you want to read. And of course, I asked them the big question: which one would you want to read again? to get more from it. And the first one is all about plot. There's no reason to ever read it again. And the second one, there's so much there if you just keep, kind of unlocking some of the language and devices that she's used in the piece. So there's a lot so that's kind of how I like to get them into it a little bit.
Do you have, because one way I would try to describe what the shift was I went through when, reading something that had what I'll call more substance, was I got to the point where I felt like I went from reading a story to like listening to the story, and rather than, and like I was participating in the story that I was reading rather than just like performing the act of reading the words.
Right.
And so but that is not something I learned until my late 20s. Like I didn't connect with that until my late 20s. So my question is, and this can be directed towards like high school students or even like the early college students, where I feel like there's an effort to be developing this ability, like this reading comprehension ability, that for me at least, and I'm to no fault of my education that I received was top notch. Like there's no denying the fact that I'm sure there were people in my high school and college who got that out of it. I just never did.
Mm-hmm.
How, in your eyes, can a teacher maybe like try and guide a student through taking on that task?
Oh, that's a great question. I think we have to do that. I think because you raised a very good point that you didn't get that till you were like 28, 29. And I think that's one difficulty in teaching, say, in Intro to Lit class to, 18-year-olds, your typical 18-year-old, a 19-year-old, because they haven't lived life enough to know yet, the hard realities. And literature is usually about, what I love about literature, and one reason I think I loved writing about it for this book, is that literature is more about the ambiguities of life. It's about the gray areas. It doesn't, good literature isn't black and white. It doesn't tie up neatly at the end, and it leaves us raising more questions rather than it trying to solve any. And I think it's that I try to teach them the importance of that ambiguity, because that's what reality is all about. That's what life is all about. Life is ambiguity. It's not, right? I mean, it's not, the hard questions. Literature gets at the hard stuff, right? It doesn't, like I'll have students in a beginning class telling me, lit class, saying, why is all this literature so depressing? How come it's always about, tough things? It's never joyful. Well, I obviously have examples of good literature about joy, but I say, because joy is something that's easy to experience. It's easy to, easy to express, but it's authors are trying to work through things, and they're trying to get us to think about the struggles in life and the harder, aspects of life, for the most part. Not all literature, but even literature, for instance, I often will begin with a poem by Mary Oliver, and she's one of my favorite contemporary poets. She died only a couple of years ago, and her poetry is very accessible. So a lot of people initially, when she started writing, thought that her literature was too simplistic. And it's largely about nature and the importance. On the surface, it's about being out in nature and the importance of experiencing nature and so forth. But it's really about much more than that. It's about paying attention. It's about living in the moment. It's about not spending our time living in the future, or looking to the future or looking to the past, but because then you lose living in the moment, right? You've never lived the moment. You've only existed in it. And so I talk a lot about that in my lit class. And I think that anybody who reads a piece of literature and really, it participates in it in the way that you're saying, that takes time. It takes practice. It takes looking at literature on a number of levels, I think, too. So what I tell my students is when they read, I mean, they're most adverse to poetry initially, most of them, because I'll come back to a point that Nick made earlier, and that was like we don't like what we don't understand. And so poetry's kind of usually tougher, initially. And so we tend to say we don't like something. And really, it's not that we don't like it. Maybe we haven't been exposed to enough of it, or maybe we just don't understand it. So it's easier to say we don't like it. But anyway, what I tell them to do is read it through first. Just get your gut reaction from it. What did you feel after reading it? And if you didn't feel anything, then you need to read it again. And maybe it made you angry. Okay, good. Then go back and find out what made you angry. Who made you angry? How did the writer make you feel this way? What techniques did the writer use to guide you to feel that way? Or are you bringing that baggage to the piece, right? So I think, too, it's really important for a student of literature to realize that there's the piece of literature itself that is this wonderful piece of art, and it's a living piece, but that you are a living being that's reading it. And so you bringing your stuff, all of your stuff with you to this piece. So you may read it differently, right, than someone else who brings something different to it. Like, say it's a piece of writing about a family in India. In fact, I have a couple stories that I typically teach about that, and about, and it's about an arranged marriage and so forth. Well, an American young student, inexperienced student, has a very different reaction to that. Well, I don't understand why they don't just get divorced. I don't understand why do they have to listen to their parents, and because they're not taking into the context, right, of the piece. And so I think getting them to read something in a variety of ways from a variety of approaches really helps them read something more attentively and more mindfully, so that they can participate in it. And also, one of the biggest goals I have in teaching literature is to create empathy. Literature creates empathy, and in ways that, all the arts do, I think, but in a way that other things cannot. And I try to get them to see that, and that's something we should all be practicing and trying to strive for all the time.
I love that the ambiguity is something that we should really embrace. Mm-hmm. I'm reflecting on how I've participated in a couple Shakespeare classes. Yeah. And so challenging. And it really deterred me away from literature to one extent. But at the same time, when I felt like there was something that I understood, I was like, oh my gosh, this is beautiful. I really want to learn more. And I don't even think it was that of course, some of the words, I was like, okay, I understand some of these. And so it's great. But there were just definitely some of the sonnets that I felt like I didn't name it until you named it now for me, that I definitely had a gut reaction to it. And that's what the understanding was. It wasn't just that I understood what the words were on the page. And that's what maybe wanted me to excel more in this and understand more. And that, yeah, regardless of where you're at, there's this initial reaction that you can have to what you're reading.
Exactly.
It doesn't matter about the understanding. And that's what you can bring to the book or to the page. And
that's where you start. It's a starting point. It's a great starting point. Yeah.
Yeah. I really enjoy that.
With Shakespeare, I think too, like you say, I mean, initially it's very challenging for students and for a variety of reasons, right? I mean, the language is so different from that, from what we're accustomed to using, and there's that barrier in a sense. But when you get at the universal themes and ideas that he's touching on, I mean, you realize that they're the same kind of, they're the same kind of questions and doubts and struggles that we face today. And then when you start to have that gut reaction, then you start to go back and say, look how beautifully that's said. I mean, look how, let's put it in plain English, and let's use contemporary language and try to say the same feeling, and look at the difference. And then I also try to bring in all the phrases. There's this wonderful handout, and I don't know who to attribute it to off the top of my head, but I use it in class, and I do, of course, attribute it. Of handout of the over 100 expressions that Shakespeare developed that we still know and use today, but don't realize they're from Shakespeare. And so it's a great place to kind of start with them, to make them see, look, it's not so different. I mean, these are phrases that we use today, but he's the one that came up with them, So there's always a starting point.
Mm-hmm. Yeah, I think, in a lot of ways, I think for me, the one that made this the most accessible was Meditations by Marcus Aurelius.
Oh,
because I think, and like reflecting back on it, I think that book for me it was more, because it was written as a journal. It was more of it was just the interpretation. It was the thoughts that I should have been having about the scenarios that I was living, right?
Wow,
I didn't have to do the thinking about what was going on. He did it, and I just lived through that. Because he even, there's a passage he has in that book where he says something along the lines of how great it would be to just lay here in bed in the warmth of the sheets and do nothing. But who am I to think that I don't have to rise at the beginning of a day and carry out what it means to be a human, a man, a human being.
Right.
And it's that's such a real struggle that a lot of people go through, but he puts it in such a way of yeah, you've got responsibilities to do, and you've got to get up and go towards them. And so that, there was something about reading that was just it was a breakdown of just these universal themes kind of that were just so plain. And they were the thoughts of somebody who was living things. It wasn't the story that then had to be recontextualized. It took a lot of the thinking out of it, I guess, that kind of.
Well, that's really interesting. I love that. In fact, I wrote down the title. I'm going to order the book as soon as we get off. So thank you for that.
Yeah.
But I like what you said. It's the idea that when you said that they're doing the thinking, or they're expressing the very things I'm feeling and experiencing, and that's what great literature does, right? I mean, it humanizes. I mean, it just so humanizes, experiences of life, and through the imagination and the subjectivity of it, it makes something real, more real than reality, in a sense. And again, that's one reason with the book that I try to have. I'm hoping people find it to help them, find that piece that says exactly what they're experiencing, because that's quite a moment when that happens in any literature, right? I mean, when you read something. So, anyway, you said that beautifully. I'm looking forward to the book.
Yeah, it's depending on which interpretation you find, it can be a difficult read. So I don't know. I don't remember which one exactly. I know Penguin does their version of it because it's so old. But the Stoic philosophy stuff can be written in a lot of that traditional Latin flow of the language, I guess. So yeah. I think I really enjoyed it. I had a lot of takeaways.
That's great. Terrific.
Yeah, there's just this theme of not feeling so isolated, and literature and stories and narratives really provide that. We're social beings, and when we don't talk about these things with each other, but we write them down and then read them, it helps us just feel so connected. And I learned so much from any type of story. So I do work with some youth and families, and so I've been reading a lot more children's books, and man, they are so powerful. Every time I read a children's book, I'm just this is beautiful. The way that they were able to express some type of conflict, involve different people within the story, use different types of analogies for kids to understand, and then come with some moral or some teaching at the end within 20 pages is amazing. And so few words too, but such big impacts. So yeah, just storytelling in general is something I've really started to fall in love with, which is it's a nice process.
It is. That's wonderful.
Yeah.
It's nice you're doing that with your young students too, your young people you work with. That's great.
Yeah. Yeah. And it's, again, like just speaking to that it's such a good way for people to learn.
It is.
There are some things you just can't express, like some things that you just really can't say yourself.
Exactly. In fact, again, just come here for a second, to when you go to a doctor, for migraine, and they'll say, rate your pain on a scale of 1 to 10. I want to shoot them. It sets up a certain rage in me, because I'm like, well, what your 10 and my 10 are probably very different, first of all. Plus, it's like, I just find that I know they have to find a way, a kind of clinical way to do it, but that's why I wanted to move away from that and say, tell your story, let's hear the narrative of what you're going through and what you're experiencing. And that's what storytelling allows us to do, for sure.
Yeah. This has been wonderful. I was wondering if you had some last words that you really wanted to share with listeners or viewers, maybe about your process through literature and process through migraine, whichever you'd like to share.
No, I guess the last thing I would just say is that, anybody, I think a takeaway would be that literature, there's a famous quote in this great movie. It's probably too dated for you guys, but it's one of my all-time favorite movies, called Shadowlands. And it's about the C.S. Lewis, who, the great C.S. Lewis, but he was teaching a class, and this one kid in the class, he was teaching at Oxford, right? So and this one student, he would call on, and usually the student was asleep or something, and then finally he met him years later. He didn't do well, obviously, in the class, but years later he met him on a train, and there was this first tension between them, and then the former student said to him, he obviously had grown up and lived life a lot, and he had said to him, that question you asked me that I never answered, I have an answer for it now. We read to know we're not alone. And it was just, it's such a simple phrase, but the way he says it, and the clear sense that he had learned that through experience, and that he had taken in some of what that class was about, right? Even though it didn't appear that he had, and he had thought about it. And I think that is the greatest takeaway from literature. One of the greatest. I think one is the power of language, and two would be that find that piece of literature that you need. We talk about literature as a companion. It's been a companion for me, and I turn to it in all kinds of times of struggle, and that's often how I find the literature I love. So I just invite and encourage everyone to read, and think about what you're reading, and find that piece that you need, or let it find you.
And I think that's the mission of your book, right? To make sure people out there know they're not alone.
Yeah. So,
it is. It's the incredibly most important piece. And, it's like, I know I'm never going to make a dime off of this book. So it's like, I don't like one thing I could just throw in is that publishing a book like an anthology like this is you have to get permissions for every text that you include. And I had the very generous gift of, I like to get this out to any time I can, from Dr. Frederick Godley he's the president of the Association of Migraine Disorders. And he believed in my project from its inception before I ever made it a book, when it was just an idea. And he wanted his organization to help me with funding for permissions, because he knew, and I knew, permissions were going to be exorbitant for me. And I didn't have that kind of funding. When he found out his organization could not, because I was not a non-for-profit, could not give me a donation of that kind of funding, he wrote me a personal check before the book was ever written. And I could not have written this book. I could not have written it without his financial assistance. Sometimes getting a piece put in a book like that, to get permission from a publisher is $400, $500, $600 a piece. So I guess at the point I want to make is I don't ever intend to make $1 off this book. I never did. I want people to find it who need it. That's what I want. And thank you for the opportunity to help me do that. I really appreciate that greatly. And taking so much time with me. I've really appreciated that. It's been a joy to talk with both of you.
Oh, likewise.
Yeah, very, very reciprocated feeling.
Yeah. Thank you for opening my understanding about this topic so I can be a better support to the people around me.
And thank you for being open to that. Appreciate that.
Yeah.
Very much.